system where bureaucracy and the insurance companies is ruling the day. They're the ones that force the nation to decide that we have to somehow get everybody covered, because taxpayers are footing the bill for those folks that aren't covered now. And what you're saying is that the government bureaucracy is somehow bad to try to make sure that people are covered, they get good quality health insurance, but the insurance company's bureaucracy that hires people to make sure they don't have to cover people that paid for their insurance and aren't, they're finding loopholes to try to prevent from paying for that those medical bills, or denying them coverage based on mistakes in paperwork. All of those issues is what brought this to the head at the national level. Now, the other thing that you've just done, one of the things that goes on in American health insurance is that we pay more for administration of our health insurance than anybody else in the world does. And that money is going to insurance companies. And you haven't just said we're going to pay for insurance. Now we're going to pay trustees to manage the accounts before people pay for their insurance. So not only are you paying for an insurance broker, but you're also paying for a trustee's services to administer this trust account. That just takes more money away from actually paying for health care, and to pretend that that is somehow a great thing to do to the individuals that are trying to get covered is just a ridiculous argument, I think. The other thing is that because now we have added, you're saying the individual gets to choose, but guess what? If an employer says, I'm going to put your money into this trust account with this person that I trust, and all my employees are going to have health trust accounts with this broker, he's deciding who's going to do that. That broker can say, I'm only doing business with this insurance company or that insurance company, and deciding which policies are available to them. That's what this bill does. That's what's wrong with this bill. It is not freedom to choose your own insurance. It is the employer gets to choose who he's going to do business with and who you're going to do business with if you're employed full-time or part-time. If there's not enough money there to pay for insurance, the money sits there, and they keep collecting fees while it sits there. So the idea that that the insurance bureaucracy is so much better than the public bureaucracy is just a ridiculous argument. This is a bad bill. It should go down.
Senator Benson.
Thank you, Mr. President. What we're looking at here is two fundamentally different approaches to solving a problem. One side of this argument thinks that Washington can come up with all the solutions for everybody. A one-size-fits-all approach with a $2 trillion cost, which is quite a bit of bureaucracy for solving what should be a state problem. Minnesota's done a pretty good job of taking care of our needy, of taking care of those who need insurance, of providing good access in the state. But as soon as the Affordable Care Act is passed, everybody just gives up and says, okay, we'll do whatever they tell us. Promulgation of rules. I get copies of all of these things. Guidance to give us more flexibility in our choices. Governor Dayton takes a fundamentally different approach than the group that came up with the bill that Senator Han is presenting today. He says, whatever the feds say, that's what we'll do. We have to. We'll figure out how to pay for it at some point. Senator Han is being honest in this legislation. This is a solution to a specific problem. It is not the solution to every problem. And by taking a thoughtful, Minnesota-focused approach, we are going to come up with a better answer long-term. The Affordable Care Act, the Class Act, which was a vital part of that document, collapsed under actuarial scrutiny. The fiscal note went from under $1 trillion to over $2 trillion, simply by looking at the out years on the bill. We cannot turn to the federal government for every answer. This country wasn't founded on a one-size-fits-all solution. Our healthcare system is not a one-size-fits-all solution. I trust this body more than I trust Congress to make Minnesota healthcare policy. That's why I'm supporting this bill.
Senator Thompson. Thank you, Mr. President and members. I rise to address Senator Kelash's point about insurance companies in the free market. I can assure you, having represented insurance companies for a number of years and also having had a number of cases where I've been on the opposite side of insurance companies, it is not an unregulated market. And a large part of the problem that we have right now with the insurance business is they lack latitude to make market-driven, common-sense decisions because of the requirements that government places upon them. And so, moving in the direction that Senator Hand suggests is a good one. We in this country believe that that individuals and businesses making decisions based upon profit motive is the most efficient way to allocate scarce goods and resources among unlimited needs and wants. That should be true of insurance and medical care, like it should be true of every other product or service.
Senator Sherry.
Thank you. I'm surprised. I didn't know I was going to be up next already, but I just wanted to go over a couple of things. I know there's a lot of discussion about, a lot of tension in the world around the ACA and what the Supreme Court is doing. But that's why I asked a very specific question of Senator Hand, whether or not his bill is a good idea, regardless of what they do at the federal level. Is the discussion about an exchange and how that exchange should be developed worthy of our discussion, regardless of what the actions are in the Supreme Court? Should we develop an exchange in the state of Minnesota, and would this be the form that it would be in? His response to that is that it's his bill and he supported it, thought it was a good idea, and so he shares with me at least the belief that an exchange as a concept, regardless of what happens in Washington, is a good idea. The second point I'd like to make, and excuse me, I'll go back and I want to narrow that because I know there's a lot of tension about what the role federal government should have in the development of an exchange, and et cetera, et cetera, et cetera. And I'd like to set that aside for a while and talk about the merits of what Senator Hand has put in front of us versus what the task force is considering and whether or not a methodology that's proposed here is in the best interest of the state of Minnesota. And I'm suggesting to you that what is inherent in this bill is taking resources, collecting them, putting them in a trust that is managed and operated by an administrator, and that administrator is defined clearly in the bill as a person who has a conflict of interest, has more of an interest in selling a product out of their own menu of potential insurance products than the exchange system that Senator Lori was proposing, which has no special interest involved in determining what the products are that are out there, what their costs are, what is included in them, to allow the consumer to take their dollars and choose their product without an intermediary that can redirect them towards something that has a financial benefit to the seller. That's the inherent flaw in this bill, is that and in addition to it, like other proposals that are allowing the insurance industry to take from the Minnesota care population only those that are the healthiest, cherry pick those over 133% of poverty, and then set aside those they don't want to cover because they have too high of a risk, and require those to go back onto a very expensive Minnesota Comprehensive Health Program. And now the money from that program is to go into this trust to be managed again for a fee by a person who sells insurance products. That is not what we want to do in the state of Minnesota. If we want to protect the consumer and allow the consumer of healthcare services to have control over where their healthcare dollars are spent. An exchange that does not allow these premium administrators to intervene is in the best interest of the state of Minnesota.
Any further discussion? Senator Hand.
Thank you, Mr. President, and perhaps we're getting to the point where we're ready to vote. But I think there clearly is evidence of people in this room who mistrust or maybe don't like insurance, don't believe in insurance for whatever reason. But there's no question. I would encourage people who don't believe so to do a little reading and check it out. But insurance is a great idea. It is something that has been extremely valuable to people throughout human history. And all I would say is that one of the things that has been a problem as we've talked about health care is that we have not looked at insurance